of the main things that keeps it alive. So it was a really great experience, and I got to meet a very fun team who will also introduce themselves.
Hello, everyone. My name is Manushi, and I'm currently pursuing BBIT in Strathmore. And I'm a part of the IT team for the foundation, and I'm also building an app for the foundation. Yeah, looking forward to working with the founder. Thank you.
Good evening, everybody. My name is Hital. So the experience has been amazing, and what there's been a learning curve each and every day throughout the foundation till today. So I disseminate information to the stakeholders through the project reports and articles that are published on various newspapers that our organization features on.
Good evening, everybody. My name is Aruna Varsani. I'm a founder of Together for Better Foundation. And I cannot give further introduction because my team has taken up my introduction. So I will only listen today. Thank you.
Good evening, everybody. My name is Dia Halai. I am from the SIMS faculty studying financial economics. I joined Together for Better early this year, and I am part of the statistics and logistics team. Each day with the foundation is a new experience. I learn how to radiate love, reach down to people, and give a ray of hope.
Good evening, everyone. I am Nikhil Makwana. I'm doing financial economics from SIMS faculty, and in this organization, I mainly handle researching of data and researching data and handle data for the organization.
Good evening. As you couldn't tell, I'm also a student at Strathmore University, the 7th one currently, I'm guessing. Yeah. So I'm an actual science student in the SIMS department as well. I usually, with the foundation, handle the documentations, the legal requirements, and like the contracts, and also the networking building. So yeah, I also joined this year. And you learn more about the foundation with the presentation which will just happen. And I joined because I believe that like from what you'll see, that men should be more involved in this in this cause. And seeing how the stigmas and everything have been going on regarding the topic, I feel like it's time we should break those stigmas and break that barrier of men getting involved with the topic. Yeah.
Yeah, so why will I let my founder introduce everything? So, born in Gujarat, India, and migrated to Kenya when she was 11, she has fallen in love with this country and its people, and it's now become her home, her country. She is Mrs. Aruna Varsani, the founder and the leader of Together for Better. Yeah, so she is passionately involved in charity throughout Africa. Her greatest motivation and joy is the impact to the women and children. Reusable sanitary pads has always been the top of her agenda due to the problems faced by the girl child. Many have no access to sanitary towels, and they obviously depend on or rely on donors to use such equipment. Aruna believes that reusable sanitary pads will help solve this problem, and her experience has also established, built, and upgraded over 45 libraries, and which are found in rural and informal housing in Kenya. So, Together for Better Foundation was formed in 2016, and since then they've been trying to solve two agendas. Firstly, the provision of menstrual hygiene management, and secondly, the provision of literacy education. So, we as a foundation are trying to create a solution of effective menstrual hygiene management through our full cycle sanitary kit and the provision of education, training, and adequate information regarding menstrual health hygiene. Our aim is to effectively demystify the myths of menstrual health with informational education. So, a small story of the foundation. So, Aruna has ever been doing small bits of support to the needy, and she realized that there was a gap in provision of menstrual hygiene throughout Kenya, and so she decided to do something about it. So, with a vast group of women in low income slums and villages, young girls were directly beneficial to the program, and the reusable sanitary pads has also created employment for over 50 tailors in Nairobi. And this has also increased the awareness and has brought evidence that the program is related to menstrual health hygiene, and as a result there are documented reduction in not only absenteeism but also dropouts among young girls from students due to not having the access to this management, this menstrual hygiene management.
Hello. I want to bring some small introduction here now together who we are. Our mission is to reduce period poverty because across the world, about 500 million girls go through with the challenge of availability of period poverty or available of products to use it in a menstrual cycle days. Our vision is to empower girl, make sure she is empowered with the product, with education, and also we distribute the pads which are reusable sanitary pads. That's why we are say that we are innovators. We keep working towards the mission and the vision of foundation. What we do, we actually manage menstruation health management with a strong heritage of advocate for advancing right in vulnerable women through mentorship. When I say vulnerable woman, it's not only underprivileged. Any woman sitting in this audience or any woman sitting or girl sitting on this stage, it's still a vulnerable. To make the generation better and inform women, especially in mobilization and communities in across Kenya. This is our Together for Better full cycle sanitary kit. Our reusable pads are designed to super absorbent, reduce leakage, and offer better protection and comfort for up to 2 years solution. The pads are also discreet and come into muted color. These all factors we have looked into it when we have really collected testimony from the girls on the ground. Our pads, source of cotton. Definitely we have to look for cotton material because it's allergy proof. Also, same time is absorbent. We work with our partners from the different counties, different sub-counties also. They offer us great comfort for the regular use and disabled for the 2 years. So basically, our pads have been made out of 100% cotton. We make sure they are muted in colors. Yeah, and the size is also we have specially designed according to testimony we have collected from the ground. Layers of the protection, as you can see on the screen. We make sure we don't compromise on these layers because the moment you want to reduce the cost, that means we are compromising on quality. We have a safety on these pads by using Velcro to ensure the pad stays in position while a girl is active during the day, or maybe when girl is doing any sports or a woman going to the work office. Labeling. Our labels is edible to each pad as a stamp of our guarantee of quality. We held the responsibility if in case something goes wrong on the ground while they are using our product. Packing of distribution. Each girl receive a pack of 6 pads. My accountability is 2 for night, 4 for daytime, enough for one cycle for one girl. Each pack is neatly tied with a fabric knot, and we are recommended a first wash before we use while we distribute, because it's a hygienic product. While we are giving menstruation education, we must also give them a knowledge about how to maintain the kit. Now, compound family saving. We all understand there is a period poverty. That means there is a financial challenge also when it comes to the girls. With the average of price of 6 packs, normally a small packet which is single-use pad costs 50 shillings. That's the lowest. The highest, if you look at it, it costs about 250 shilling to 300 shilling. So per year, per girl is spending about 1,200. So if you multiply by 2, a family for one girl to maintain the cycle, they need 2,400 shilling every 2 years. For our pads, our offers great value because 1, we support them. 2, it's a solution for 2 years. On top of that, we follow some of our SDGs, which I'm going to show it on my screen. So job creation. These pads are made in Kenya only. I don't source it out anything from outside the country. Yeah, to make sure we continue manufacture it and make sure it's available for our women. On other hand, we run a workshop to the other organization, come and learn with us how to make sanitary towels, because our motto, our vision is to impact in every sector where we get opportunity.
So how can you help the foundation? There are 2 ways in which you can help the foundation. First, you can sponsor a full cycle kit to one of the girls.
Yes, did you want? No, you can go back, please. Now, these are the out of 17 SDGs, we follow 13. Regularly, religiously, we make sure we keep growing our SDG goals. So partnerships, sustainability, and funding is what we are seeking each stage, each time. And that's why we are on the stage that we ask for help also at some point, because it's 100% charity. As you can see, our team is empowered. One is IT person who is creating the app. The second person, legalization, checking constantly on documentation. So my aim is to make the team at every sector, make sure there is somebody responsible, constantly looking out on the growth and every sector. Yeah, so these are our 13 SDG goals. But by end of this year, we are promising to adding 2 more goals, because we are looking for sustainability, but at the same time, we are looking at partnerships.
So how can you help the foundation? There are 2 ways in which you can help the foundation. Firstly, you can sponsor a full cycle kit where you'll give a girl child confidence to go to school, as you'll be providing a kit with 6 pads in it, which will be extremely comfortable for her and will give her confidence to go to school. And you can even give your volunteership into the foundation, where you'll give your time, which is of course worthy, and obviously you'll benefit from it, as we are seated over here because we benefit from it. So our foundation has also created some few statistics regarding the beneficiaries. So there are 145,264 sanitary pads of Together for Better, which have already been distributed since 2016. And 25,028 girls and young women have been empowered by Together for Better Foundation, as well as the second agenda of the foundation, which talks about literacy education has reached about 37,380 books to libraries which are at 40 different locations.
Our partners on the ground. We have partners who are on the ground. Sometimes we travel across the Kenya, we go to the borderlines of our country. So these are our partners on the ground. When I say partners on the ground, remember, there are many different sectors you need partners, and they are on the ground to help us to do the logistically collection of the schools, look for the vulnerable schools and girls also, look for the communication, look for our security also. Not every area where we go, security is also another concern. So these are the partners on the ground, but when it comes to the financial, we are still looking for funding. We are constantly applying for the grants, and this is how far we have managed to reach. Comes to the sustainability, I have tried to reach out to the Kenya Bureau license, but they don't provide yet, so I cannot sell this kit to anyone. I can only donate, or maybe indirectly we can look for the CSR project. So those are the only key factors right now we are working. But this year, as a team, we have put a target of supporting 10,000 girls. This was taken promise in January. As we are talking, we manage already 5,000 girls. So that means we are soon going to hit our target, and we will able to do more girls than 10,000 girls for this year. Thank you.
These are the few of the many recognitions that the foundation has achieved since the journey has started. So one of it is the Indian Achievers Award from 2021 to 2022. And secondly, the celebration of Shujas, which was done by AMREF, recognizing a founder through Together for Better, where she stated that my work with AMREF Health Kenya involved teaching girls and women in rural areas how to make reusable sanitary pads and raising funds for their project through a cooking club. Happiness is achieved by helping people in need, and I thank AMREF for letting me be part of this meaningful work. So why not we all come together for better for the people in need? And we would like to show you a short video on our project which was done in Marsabit, start of this year, which was Feb 2022. Hope you all enjoy.
Hello everybody, my name is Aruna Varsani. I am a founder of Together for Better Foundation. Project Northern Kenya is very special because it's been 1 year we have been trying to come and support the girls.
We were blessed with a team from Together for Better who came to Marsabit to touch the innocent heart of girls.
So many challenges and obstacles have come across. We have been planning since last year, but we have managed to do this year with the support of full team of County Government of Marsabit and AMREF Health of Africa. We have managed successfully to complete the full project.
Maria Deng is my name. I'm the Director, Gender, Marsabit County. Basically involves empowering of vulnerable groups. In Marsabit County, because culture is deep-rooted, our women, girls, youth, persons with disability, and OVCs or orphan children are facing a lot of challenges. And there was a survey which was done in 2016 by a World Food Program, and there was a big gap between women and men in the county because most of the decisions are made by men, and so the other groups are not vulnerable. It's our responsibility as the Directorate of Gender, to make sure that these other groups are also lifted up. So we are doing a lot of empowerment program for these vulnerable groups. 4 or 5 months ago, we launched gender policy, which was being supported by almost 20 and plus partners. AMREF, B4We, and Together for Better falls under the same umbrella.
Some of the major area we have covered up in northern part is Kalacha, Maikona, Sololo, Saku, and Marsabit. This was amazing because each day was a different day for me on the field. But there is a security challenge on the ground with the security sensitivity between the tribal challenges. Same time also logistically, because any time the route can change for you, and it has happened through this project.
They did a good mentorship program and also provision of reusable sanitary pads. Indeed, many innocent people who have never been reached are reached by it.
I'm Brazilian and I am living in Kenya. This was my first experience working in this kind of work, and it was an amazing experience because I learned a lot and I saw how an action can improve all the life of a girl, and that we can help the future choices and opportunities of this girl. I think that the point for me is that sometimes you are here thinking that you are teaching, but at the end of the day, you are more learning than teaching.
The 10-day trip to all our areas in Marsabit County, the 4 sub-counties, many children, especially girls, were touched by the human heart that came to them and touched them.
I'd like to appreciate all the partnership we have got to support for this special project. Before we county government of Marsabit, AMREF Health of Africa, Keep Plus, but most thankful we are to use also our global supporters all the way from around the world who have supported this project to be successful. Thank you so much. Thank you so much.
Thank you so much. A round of applause to that presentation.
Question? No?
So I think because of time, the video will, the link will share as well on the portal. So thank you so much for the presentation. And we hope to achieve more with your initiative and what you're doing. Thank you so much.
Thank you.
Another round of applause, ladies and gentlemen. So we'll be finishing in the next 10 or 5 minutes. So I'll welcome XALCO Limited Mahubab to give us a final presentation for today.
Good evening, everyone. I promise to keep this short. I know it's been a very, very long evening for all of us. So thank you for staying on for this session. I hope it's been good for you. So I'm just going to go straight into it, and I'm just going to dive straight into it. So XALCO Limited, we're in the healthcare industry, of course. And since he's already skipped to this video, I have a question for all of you. How many of you live with your grandparents, by a show of hands? Live with your grandparents? Yeah, live or lived or know somebody who lived with their grandparents? Nobody? Okay. Like 4 or 5, 6, 7, all right. So I'm getting to the main point. So we at XALCO Limited are better known for our 3 brands, which are Ujuzi Fursa Africa, Home Care 360, and Comfort Care 360. So XALCO has addressed niche market needs in the sectors of upskilling the workforce through Ujuzi Fursa Africa, and improving access to care by bringing it to your home through Home Care 360, and creating a haven of palliative, transitional, and respite care. So respite care is quite new in Kenya. A lot of people don't understand the concept, and this is why we're here to introduce this. Okay, so we do support the 3 sustainable goals mentioned here, 3, 4, and 8. So I'll just let you read that in your own time. But Ujuzi Fursa Africa deals with training Kenyan youth, basically individuals who do not come from a very wealthy background. They come from low-income backgrounds. They haven't had an opportunity to get into school, to study anything else. So we literally have a very low requirement of a D plane at secondary school, and we let them come and train with us with an internationally recognized course, caregiving course. And it's just 3 months. And once they train with us, we actually deploy them to patients' homes through Home Care 360. So this gives us the opportunity to give them the opportunity to make something better out of their lives, while also upskilling and creating basically a workforce of caregivers that we really need in this country, right? Okay, so just to take you through this very quickly, founded in 2017, we operate under the SDGs that we had previously shown you. And just what I said, we train the youth to become certified caregivers. And our course, by the way, is from Singapore. And we prepare them for the market. We also teach them soft skills. And 30% of them actually, some of them go abroad, some of them apply privately at hospitals, they get great opportunities. Some of them use this course as a stepping stone to get into nursing school, for example. And 70% of them actually also stay with us at home care and work with our clients. And of course, we are filling a gap in the market by providing caregivers who are professionally trained. Now, the culture in Kenya previously, or even currently, is that we will get our grandsons or relatives to take care of the elderly, whereby they're not trained to do this. You know, they could perhaps lift the old lady and maybe break a bone. It's very, very possible. So our caregivers are trained on exactly how to treat these patients of different conditions. Okay, so respite care, like I mentioned, is like a new concept in Kenya. A lot of us feel like if we have an elderly loved one at home, we have to be with them 24/7. We have to, sacrifice everything, not go for that business meeting, not go for that holiday. But actually, we don't have to do that. It doesn't have to be that way. If you need to travel or you need a break as the caregiver of this elderly loved one, you can leave them with us at Comfort Care 360. So if you're following me well, we have Ujuzi Fursa Africa, which is the training center. Once we train these caregivers and they're ready for the market, we deploy them through Home Care 360. And lastly, we have Comfort Care 360. So respite care is one of them. We can go next. So I'll just let you read through this and I'll just summarize it quite quickly. We have a step-down facility at Comfort Care, basically. So I think we were talking about the patient Fatuma yesterday. I think she was from Djibouti. So if I can just continue with her story and how if she comes to Kenya for treatment from Djibouti, what happens? She has her niece who doesn't know where to stay, for example, probably staying at a hotel which is far away from the hospital. And once Fatuma is discharged from the hospital, where does she go? Because she's not fit to travel back to Djibouti. This is what a step-down facility is all about. Yeah. So Fatuma can come in to get her last 5 days of antibiotics, for example. We have the facility to have this medication administered. Her niece can also stay with us. So she has her relative with her. She's comfortable. And the facility is actually really, really homely. So we do not want to mimic a hospital. We do not want to just add to what's already available out there. So our facility is quite different and has this home away from home feeling. All right. So some of the perks actually of Comfort Care are the one bill concept. Now, I've heard a lot of controversial talks from yesterday about Kenyan, medical facilities overcharging. For example, you have these invisible items that just pop up once you're discharged and you're looking at your bill. So at Comfort Care, we have a one bill policy, if I can call it that. So when you get your bill, you're not going to find like, oh, gloves were charged for and masks and this and that. You just have a single bill for which you paid for your bill. For example, 15,000 Kenya shillings, that you'll get the support. And the nurses will, depending on the package, you would have nutritionists coming and checking you. You would have various other specialists coming to see you. So that just falls under one bill. And then, of course, the 360 approach, right? So we have some of our current patients with home care who come to Comfort Care for like an adult daycare. So they come, spend the day, get a break from their normal routine at home, or if their relative or their son needs to travel, they come to Comfort Care for a couple of days. So we have our caregivers with the same patient, with the patient from the hospital home at Comfort Care, so we're able to track their progress and try to improve the quality of their healing. Of course, the environment, like I mentioned, serene and therapeutic. It's nice and green. There's an outdoor seating area. There's a recreation room for the elderly. There's so many games that they can play, so it's something that's interactive for them. And of course, equipment. Once you're there, we have wheelchairs. We have anything that the elderly would require to be mobile, to be comfortable. So the multidisciplinary team, I think already mentioned a few of them, nutritionists. We have a psychotherapist on board because we really want to focus on mental health. And sometimes we forget that the family members of somebody with, let's say, a chronic illness are also very much affected. It's not just the patient who's going through something, but the family is also going through something. And usually they don't seek help. Yeah. And I can safely say that because I'm one of them. When my father was very ill, cancer, I didn't realize how much that affected me. And now I really wish I would have seen a professional as his health was deteriorating, right? Not just at the end when everything blows up and then you're like, oh my God, I need to talk to someone about this. So it's accessible. It's on First Parklands Avenue for those of you who are who are aware of Nairobi and the environment. So First Parklands Avenue, very, very close to Aga Khan Hospital. Okay, so just a quick comparison, and I won't go into full details, but I just mentioned the all-in-one billing system, and of course, wound care. Our wound care specialist is quite popular. He's really good at treating wounds. I'm not just promoting, but I've really seen it, and it's quite impressive. Of course, use of equipment is, included. You don't have to lease a special type of wheelchair. For example, we have a lot of these high-end wheelchairs. And of course, cost saving. If you need to get any test done, if the patient needs to get any test done, of course, we have facilities that we partner with that we can do this. And at the end of the day, once the patient goes through this experience, they feel better and ready to go home. They're happier and they're just ready to transition back to their home, not have to go from the hospital and set up a hospital room in their homes. They can just have that transitional care with us, and it overall improves the patient's healing and the speed of healing as well. So this is just a quick graph here, and there's a 55% cost saving if you stay at Comfort Care versus a hospital. after your treatment, whether you had a surgery or you need some kind of IV medication to be administered and you can't do it at home, Comfort Care is the place that you can have this done. So quality, again, the nurse to patient ratio. At hospitals, of course, and we all know this and we've seen this, we have a lot of patients that one nurse is probably attending to. And at Comfort Care, we have a 1-to-1 ratio. So the capacity is limited for a reason so that we can provide that quality care to our patients. So these are a few pictures of the facility. So you can just have a look at those. That's the recreation room right there. We have the outdoor seating area. We have the rooms that, of course, are, good for infection control. That's what I'm trying to say. So they've passed all the tests, but they also have that homely feeling to them. So yeah, that's basically what I wanted to present about. And how is this innovation? I don't know if you can hear me. Can everyone hear me? Okay, it works now. So how is this related to innovation? So the whole concept of the 360 care concept, basically, starting from how we train the Kenyan youth to become caregivers, and after that, how we deploy them to patients' homes, how we control that quality of care, and how we monitor our patients, and how we give them the opportunity to come to Comfort Care and enjoy the facility and give respite to their family as well as to the patient. Sometimes the patients need a break and they need to leave their homes, but maybe they're not fit to travel, not even as close as Naivasha, for example. So this is the place to bring them. So thank you very much for listening to me. And I'm also so happy to be here because I was a Strathmore student about 6 to 10 years ago. So it's nice to be here again. Thank you so much for listening to me.
Thank you so much. A round of applause, ladies and gentlemen. So we are at the tail end of today's session. I hope it's been insightful from morning when we had farm access with Dr. Osundwa, followed by the insightful discussions that we had. I hope it has been enlightening. What Professor Rogo indicated in the morning and the discussions that we've done. I hope we continue with the same model tomorrow. So I thank you so much for your time the whole day, having sat here today, listen to the presentations. I'll remind you once again, the site is still live. If you missed any of the sessions, you can dial in our site, the online portal, yesterday's session, today's session. And also feel free to share, take photos, tweet, and ensure we finish tomorrow on a high. So, and remember what Dr. Anastasia said, there's something in the evening at 3 o'clock. So let's go rest and enjoy our evening. We see you tomorrow morning, same time, same place. So have a good evening. Thank you. A round of applause for me.